St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, anakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
A very good morning. Thank you for joining us on our health talk show with me, Maureen Kimani, a program brought to you by Capuchin TV in partnership with St. Mary's Mission Hospital. Well, today we shall be discussing about esophageal cancer. Probably maybe you have ever heard about this name or this word. And before we get to know much more about this topic, because we have a doctor in the studio from St. Mary's Mission Hospital who will be telling us more and to help us understand some of the signs and symptoms, the risk factors, and what are we and where are we in Kenya when esophageal cancer is concerned. But before, just to give you a brief globally, a research that shows that in 2005, there were 497,700 new cases that were reported, and in that is 416,500. And the speculation are by in 2025, because I've just mentioned about in 2005, the increased number will be 140%, of which it's a very high percentage. And we shall be getting to know more about this. And in case you have any question, you can send them to us on 0717-426-86, or you can use our SMS number that is 21760. Let's talk health. How are you, Dr.
I'm doing good.
How are you doing?
Morning. I'm doing
You're
fine.
good? It's
I'm
a good
fine.
morning.
Yeah, it's a good morning.
Thank you for making time here, and because it's the first time we are having you here, kindly introduce yourself to the viewer and tell them what you do at St. Mary's Mission Hospital.
Yeah, I am Saul Kipchirchir Naibei. I'm a doctor at St. Mary's Mission Hospital. And is there anything else you wish to know? I think that should suffice.
That's enough. Yeah, that is Dr.
suffice.
Saul
Yeah.
from St. Mary's Mission Hospital. Well, we're talking about esophageal cancer. Tell us and tell our viewer, what is it all about, and where is it located in human's body?
So when you talk about esophageal cancer, I think there are two words that I think I'll best try and describe. So for esophageal cancer, we have the esophagus and the cancer. I'm sure cancer, we have all heard about what it
Definitely.
is. Maybe most of us still don't for real understand what really is, but we try to grasp at least the much that we can. So to just tell you, the cancer is usually a growth. For most of us, I think we have growth. I think sometimes we see growths in different parts of our body, and usually it comes out of the fact that our cells that are supposed to regulate the growth, that fails, and then cells which usually is supposed to degenerate, fail to degenerate, and then they grow to become a cancer. Cancer is now any tumor that now becomes malignant. Yes. And then esophagus itself is now the tube that when you're feeding, I've just had my coffee. So when you're feeding, you just, whatever you drink, whatever you swallow, any food, it passes through a tube that starts from around this point, that is around just below your neck. So once you swallow through your mouth, behind your mouth there's a pharynx, and then beyond the pharynx, just below around here, it goes from the esophagus now to the stomach. There's a tube which is muscular. Muscular means it has muscles that just helps passing the food down from your what you have swallowed up to the stomach. So along this tube, usually is when we have this growth that I've just described. And when this growth is not controlled, sometimes it becomes malignant. Yes.
Oh, wow. And in the research, it shows that it's a deadly disease. Tell us, who are these affected by this esophageal cancer? Because we know we have the breast cancer that affects the women, and we have for the other one for the male. What's the age also for the age preference? Maybe you can talk to us about that.
You said the breast cancer that affects the female, and the other one that affects the male. Which one is the other one that affects the male?
That is, we have different types of cancer.
True, that is very true.
That's what I mean.
Oh, that is what you mean. Okay, so just because you've mentioned breast cancer, I can say actually we are receiving, currently we are even receiving men with breast cancer. That's just a bit away from the topic that we're discussing. And then for esophageal cancer, actually, most of the times we say it's the older you get, the more riskier it gets for you to develop any type of malignancy, generally. But nowadays we are seeing even newborns with cancer cells. We cannot say that it's failed plan by God, but we might try to understand, and then it leaves us even more confused. But even younger people, more and more are coming up, showing up with these cancers. Like for esophageal cancers, usually the research shows that it starts from around 40 to 60. The older you get, the riskier it gets. But nowadays we are seeing even a 25-year-old, roughly our age, coming with esophageal cancer that has actually even grown to almost stage 3, stage 4. Yeah, so I wouldn't want to stick much about the age preference. Yeah, of which deal, yeah, right, it actually helps us with the diagnosis and everything, and actually having the differentials and ruling out other causes that could be whatever the patient presents with. But for sure, esophageal cancer can present almost at any age, from as early as 25 to as late as 70s.
Okay, all right, and as we continue with that, we just saw the numbers of these new cases of esophageal cancer. There are about thousands of them. Tell us, what about here in Kenya? What's the statistics?
Okay, for just talking about, now you brought in the world perspective, of which it's good. It gives us a clearer picture of the cancers that we have in the country and even out of the country. But speaking specifically of Kenya, I think we had breast cancer as the leading most common, they say female first, ladies first. So these cancers that affects ladies mostly is what we have most common. Breast cancer, cervical cancer, and then men follows prostate cancer, and now this esophageal cancer. But over time, including colorectal cancer closely following, now over time, now we have esophageal cancer even becoming more common than colorectal, even becoming almost as much as we are seeing prostate cancer. So about prevalence, we are saying it's highly rising, and even nowadays, even in our wards, you might spend even the whole year, okay, not the whole year, you can spend a considerable amount of time not handling a colorectal cancer patient, but over and over, every week, there's always a new patient you're diagnosing with esophageal cancer. So if anything, it's high. We are at high risk of developing esophageal cancer. Maybe it's something that's to do with our lifestyle, but anyway, we'll get into that.
I was about to ask you about Okay, tell us what are some of the types of this esophageal cancer, and you can tell us what is the most common that maybe you have encountered at St. Mary's Mission Hospital.
So for the public education purposes, I will not want to delve into the depths of the types of cancers that we have, because the esophagus itself, like any other part of the human body, it can be faced with a good number of types of cancers. But the most common that we have is called the squamous cancer, squamous cell cancer, and the adenocarcinoma. So for the squamous cell, you know, as I had described, the esophagus is a tubular structure, and it has muscles. So there's an upper two-third that has different type of muscle, and the lower two-thirds that have a different types of muscles. So for the upper two-thirds, so long as it's two-thirds, you know it's longer. So the risk, it has the higher preference of developing cancer, and it's called the squamous cell cancer. And then the lower part has a higher risk of, especially due to the reflux that sometimes we have. You know, the common reflux, unasema nasikia kiungulia, and then the common reflexes that we have, you go to your chemist, get your omeprazole and go back home. Sometimes it changes the type of mucosa that we have in the lower third of the esophagus, and then it can develop into the type of carcinoma that I'm saying. It's called the adenocarcinoma. Adeno means tubular, it's glandular, so it has glands. Yeah.
Okay, and I understand in every disease there are some of the stages that are just mentioned. Maybe you can talk to us, what are these stages and from stage 1 before we even get to the signs and symptoms?
So again, for public consumption, because I'm sure this is not for any medic out there, so for public consumption, I wouldn't want to say that we have stage 1, stage 2, stage 3, stage 4. At any point that you feel you have any difficulty, any health problem, this is now generally just go to a hospital and get checked. But usually we use different methods to stage any disease, any tumor. So we have it's called TNM. So TNM just means the tumor, node, and metastasis. So we try and look at where the tumor is. So the first thing is how big the tumor is and how has it infiltrated into the walls of the esophagus. I told you that it's a tubular structure, so it has walls. There's whatever is covering the inner lining, there's the muscles, and then there's adventitia. Now this is just getting into the depths. I'm sure it's not important for the public consumption. So you look at how much the tumor has grown. You look at how much it has spread into the nodes. The nodes are the same. I'm sure maybe when you are young and you hurt yourself, let's say if you hurt yourself in the feet, you find some things have swollen in your inguinal region, in your thigh. I don't know if you have ever felt such a thing.
Probably, yes. Yeah.
Or maybe if you have an abscess, like a boil, and it's swollen here, you find there's another node that has swollen in your thigh, or maybe the same thing happened to your arm in your. Those are called lymph nodes. It's just like a sentinels. They are just watchdogs for they capture. They're the first part of your body that capture any infections and prevent the spread. The same way for when you talk about cancer, sometimes they spread fast to these nodes. So if they can spread to any nodes that's close to the esophagus itself. It could be the nodes that are around your neck, if it's the upper 2/3. It could be nodes that is around the esophagus or nodes around the aorta. So of importance is that we want to make sure as this cancer spread into your nodes. And then looking at where the esophagus is itself, there is also risk of spreading into the organ that is closest to it, which is the lungs. And then just below the ribs, we also have the liver. And those are the places that commonly it metastasizes to. Metastasis is just spread. So it moves from wherever it is, which is the esophagus, and now goes ahead and affects another organ that is not there. And then when it gets to that point, when it's metastasized to other organs that are far out, distant organs, we now get to stage 4. Stage 1 is when it's just there within. We call it carcinoma in situ. It's still within the esophagus. And then stage 2 now it has affected the nodes generally. And then stage 3 are distant nodes, and then stage 4 now the organs.
Wow, let's move now to some of the risk factors of this esophageal cancer.
Now talking about the risk factor.
Because I know there must be a number.
It's good. The same way when we talk about the risk factor that for breast cancer, the first thing is being female. So everyone is at risk. You are at risk of developing breast cancer, and I'm sure you have at least, you know how to check yourself, right?
You'll tell us more about that.
But breast cancer is not the topic. The second thing about esophageal cancer is being alive. So we are all at risk. So it's sometimes when you speak about risk factors and then you speak of a certain number of risk factors and then you don't mention anything, someone who does not have any of those risk factors thinks they are excluded from it. So it's good just to state that esophageal cancer can affect anyone. Even before I mention any risk factor, so long as you're alive, you are human, you can develop the cancer. And then the other risk, the commonest of risk factors is alcohol. I think for almost any disease in our human body, alcohol is a risk factor. Almost everything, alcohol is a risk factor. And then smoking is a risk factor. Those are the two most common risk factors for the squamous cell carcinoma. I told you that's the most common. And then the following is adenocarcinoma. And the most common risk factor is reflux. Whatever's causing reflux, sometimes you see it most commonly in the obese, so weight. You see, everything is resolving about lifestyle. Lifestyle. So if we change our lifestyle, wacha kitambi kama yangu. Yeah, you have to kitambi, tuzimalize sivyo. And then for reflux, it's called gastroesophageal. Gastro means stomach, esophageal means the esophagus that we're talking about. So the contents of the stomach goes back into the esophagus, and we know the contents in the stomach is acidic. Esophagus is not built to withstand that kind of acidity that is in the stomach. So if you have that reflux, the squamous, the mucosa in the esophagus have to adapt to make sure it can also withstand the acidity. So over time it has to change. So esophagus itself was built to just transport, to make sure the food is passing into the stomach. But now it has to learn new ways of adapting. And when it's trying to change into the type of mucosa that adapts to acidity, it now changes. And there's this term called metaplasia. It's now a change of one adult mucosa to a different types of another adult mucosa. And then when you have this metaplasia, you can find dysplasia. Dysplasia is now a disorganized growth. And then we get to carcinoma in situ and then cancerous transformation. Yeah.
Okay, so you just broke down some of the risk factors. Okay, let me just ask you a very quick question. Some of the risk factors that you just mentioned that involves smoking, we have alcohol. What about for the women, because even women are at risk? What causes the women to have this esophageal cancer? What can be the main cause?
To be sincere, actually cancer itself, the esophageal cancer, we are seeing it more in men than in women. Okay. Yeah. Okay, but the risk factors that is there in men, it's the same ones that are there in women. Yeah, no much difference. Yes.
Okay, and are there some of the types of food that causes this esophageal cancer?
Yeah, they are. Okay, I just mentioned a few risk factors, but there are so many, including even the preservatives that we use in foods. We have the nitrosamines, all those. They are. So once I've mentioned preservatives, so you know all the preserved foods, all the processed food we get there. And actually, recently, part of the carcinogens are just cancer-forming foodstuffs that can actually predispose you to cancer. And processed meat it is a carcinogen. But now it's a general carcinogen. It can predispose you to any other type of cancer. So long as you get processed meat in your system, the sausage that you had today for your breakfast, the smoky you had by that smoker place. Yeah, all those. I'm not saying it will cause cancer, but it predisposes you even further. It increases your risk, your chances. So now if you have a poor lifestyle, drink all the alcohol you can get, smoke all the cigarettes that you have, you eat all the processed meat. Processed meat has a high calorie, so within no time you have that big body. You have that hiatal insufficiency. You have the reflux, high likely that you can develop that type of cancer. But do we have people who smoke, drink, have all this type of bad habits that they do not develop the cancer? Yeah, we still have them. So it's a risk factor, but not a causative. We are not going to say that, oh, you're smoking, next year you're going to have the cancer. But it's good if you smoke, if you drink, you do all those things. Just put them aside. At the end of the day, I bet it doesn't fulfill whatever void you're trying to fill.
Okay, so it's a matter of one being very careful on their lifestyle part. Okay, and with that we're going to take a very short break, but we shall be back with much more of which we have tackled about the signs and symptoms of this esophageal cancer. And if you still have any question about our topic today, please make sure you send them. We have Dr. Saul from St. Mary's Mission Hospital. Let's take a very short break. We'll be right back.
Thank you.
Capuchin TV, your Catholic broadcasting ministry. St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have a dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, anakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyo mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Capuchin TV, your Catholic identity.
Welcome back, dear viewer, to our health talk show with me, Maureen Kimani, and in the studio we have Dr. Saul from St. Mary's Mission Hospital, and our topic today, in case you're joining us right now, it's esophageal cancer, and we've been talking about whom it affects, of which we have seen both male and female are at risk of having this esophageal cancer, and some of the risk factors. We've talked about lifestyle, of which everyone has that way of taking care of themselves. But now we shall be moving on to the signs and symptoms of this esophageal cancer. But before that, welcome back, Dr. Tari.
Thank you.
Yeah, let's continue. Tell us, what are some of the signs and symptoms of this esophageal cancer? How do you tell?
So usually, now having understood what the esophageal cancer itself is, and you know which part it affects, so usually now that it's affecting the organ that you're supposed to help you swallow your food and transport it straight from your mouth into your stomach, now we can actually derive the type of how the patient will present. The most common presentation is difficulty in swallowing. So we call it dysphagia. So long as you have difficulty in swallowing, there are many other things that could be causing that difficulty in swallowing, but it's good to just have it checked and looked at to make sure it's not a tumor. Let me just say a tumor, because for cancer you have to actually prove it under histology and a microscope. So the most common presentation is dysphagia itself. Coupled with dysphagia, sometimes you can have it ulcerating. Ulcerating, it becomes an open wound, so you can find vomiting with blood, like hematemesis. Because it's becoming an ulcer, you can also find that you have the pain when swallowing. That is odinophagia. You have pain in swallowing. And then beyond just now the difficulty and the pain and the vomiting, you can now have signs and symptoms of a disease that have already spread. I already told you when we were talking about staging, I told you the cancer can actually spread from the esophagus going into your lungs, going into your liver. So if it has spread, you can actually, the patients will actually present with signs of something else. Because tumor itself grows at a very varied rate, a very varied speed. And sometimes you can have it being an exophytic mass. Exophytic means it grows towards the mediastinum, the cavity, the chest cavity, and then the tube itself looks patent. So you'll find a patient who is not even having difficulty in swallowing, but the tumor itself is spread into the lungs. So if it's spread into your lungs, actually the patient will present with difficulty in breathing. When you do your chest X-ray, that's when you see there's actually something wrong with this patient. Yes. And then if it's spread into your liver, you'll find a patient actually coming with vomiting, eyes turning yellow, and such kind of things. So sometimes in such a patient, you have to have a high index of suspicion, knowing that there's actually some primary tumor somewhere. So those are just the few presentations. But sometimes even with spread, you can also find a patient is wasted, you become weak, you lose weight, a lot of weight, especially given the fact that it's actually interfering with your feeding. So you find this person is trying to feed, you got the appetite, you got every desire to feed, but you cannot swallow. So you end up just giving up on feeding yourself. So the major ways, apart from the dysphagia, you also lose weight. Yes.
And actually, talking about swallowing of food, I have one question here. Someone says, hi, Daktari, I have tonsils and I'm not able to swallow my food. Can it be esophageal cancer?
Yeah, okay. Those are part of the reasons where, part of the causes that you can have for difficulty in swallowing. Yes. And tonsillitis, and especially hypertrophy of the tonsils, can also actually cause difficulty in swallowing. Yes. Unlikely that it will be tumor, but sometimes it can be, not of the esophagus, but oropharyngeal. So sometimes if you find one side bigger than the other, or maybe you find that it's on and off. If it's on and off, most likely it is not. But if it's been growing consistently, persistently, because most of the times with tonsillar hypertrophy, you have it on and off. You get tonsillitis right now, then it resolves. Another few weeks, maybe it's when it's cold, you have a flu, you get the tonsillitis again. When it's on, it's unlikely to be cancer, but the best thing to do is just have it checked, right?
Okay.
That's the best thing. So usually when we are in the age of telemedicine, when a doctor just video calls you, you just take a photo of whatever it is, and then you're, but old is gold. So the good old way, go to a hospital, have it actually looked at with the specialists, and then go home actually being sure that whatever this guy just saw from a selfie photo you took is actually what it is or what it is not. So all is gold. So go to a hospital, have it checked. About it being esophageal cancer, especially if it's just the tonsils, I can tell you most likely it is not, unless it's a hepatad, the squamous cell carcinoma that I was telling you, and it has spread into. Sometimes it spread actually affects the vocal cords and then the oropharynx itself. Or you can have a different type of cancer that is now affecting the back of your throat, that is called the oropharynx. Yes.
Okay. And what is?
But to make sure the patient, the person is comfortable, worry not for now, but have it checked at the hospital.
All right. Thank you so much, Dr. for that answer to our friend there. And how does one feel in the beginning when you have this esophageal cancer?
Okay, for public consumption, I want to say usually it progresses. It's a gradual progress. So cancer itself does not start after. We have different triggers. So we have the first trigger, let's say maybe smoking causing some kind of mutation. You have alcohol causing another type of mutation. Genetics also is also another factor. Maybe you are genetically predisposed to this type of cancer, another trigger. So a good number of hits now gets to a breaking point that now this cells itself becomes, it mutates. And then it's become cancerous. And then when it becomes cancerous, now it starts to grow without control. And then whenever it's growing without control, at the point where now it has actually affected your feeding, that's when most likely you will start having the signs and symptoms. So you can even spend 1 to 3 years without even knowing there's any problems. Maybe you'll just have some pain in swallowing, just some discomfort, but all of us sometimes do, right? You might think just some irritation, and then the next week you're good, you're okay. You swallow a tab or two for pain, you're good to go. So you can spend a considerable amount of time without actually knowing you have cancer.
Okay.
Yeah, and that is the same to even stomach cancer, of which most of the times it is missed. You have a cancer, you're just told it's hyperacidity. You got some tabs, which actually relieves you for some time. You go home, it comes back after you finish your tabs, you go back for more, and then when actually you get to be scoped, when actually someone looks into it, that's when you find it's actually there's a tumor. So most of the times it's just good to have, as I said, all is gold, go to a hospital, have it checked, and you can always come to St. Mary's. We'll take good care of you.
Yeah, and that's why it also remains to be a deadly disease.
Sure.
Okay, with 416,500, that is some of the estimated numbers.
That is a high number.
Yeah, very high. Okay, let's now move on to diagnosis and treatment. What are some of the tests that are done to diagnose and treat this esophageal cancer?
So usually when you come to our facilities presenting with the symptoms that I've just said, you are likely to be encouraged to have an imaging, and this imaging it's endoscopy, OGD, oral gastric duodenoscopy. So you look at we'll start looking straight from your mouth, down through your oropharynx, through your esophagus, into your stomach, and the first part of your intestine is called the duodenum, just to make sure it's clear. So if you have a growth in your esophagus, for sure there's just a tube that we put through your mouth, and then it takes photos along the way, and we are able to look at every part. Actually, it's a video all through. We know exactly what is happening in your GIT. GIT is the gastrointestinal tract. So if there is any growth, what we usually do, because I told you for endoscopy you just get the image, we just see a growth, but we will not be able to know if it's a tumor or it's just a growth. We can have growth that are actually not cancerous. Yes. So if there is any growth, we can take a biopsy. So that's the next thing that we do. We can take a biopsy, and then for biopsy we have to send it to a lab. It has to be looked into under a microscope, and we have to know exactly which cells are in there. If we find cells that are actually cancerous, that is when we make the diagnosis of cancer. And it also tells us which type of cancer. Squamous cell is just the epithelium transforming. And then for adenocarcinoma, we have gastric cells that are now in the esophagus. I told you about the transformation. And then that is when we make the diagnosis of the cancer, and then the treatment starts. There are different ways to actually reach to that diagnosis. There are different approaches. There are things that we don't usually do nowadays, like barium enema. You just swallow a contrast, and then we take an image. Usually we don't do that, but especially given that the fact that if we can do an duodenoscopy and also the OGD, there's actually no much. That's not really needed.
Okay, all right. I was to ask what are some of the factors that affect the prognosis and treatment options? Maybe you can mention some.
So a very good thing that we usually encourage, and I think that is even the main reason that we are here, is health-seeking behavior amongst the population that we have here, especially this catchment area. So there is totally no need to have a patient at home who is complaining about difficulty in feeding and wait till they completely can't swallow, and that's when you come to the hospital. So health-seeking behavior, if we catch it early, there's better prognosis. If we catch it late, there's poorer prognosis. So it's best to if you have any problem health-wise, just have it checked by a specialist. So there's no need of just, it could be, it could not be. Especially, why should you stay in a limbo, sitting on the edge, and there's actually a straightforward answer that you can just take a short trip to the hospital and have your questions answered. So the major factor is health-seeking behavior. So go to a hospital, have it checked early enough.
All right. Prevention is better than cure.
Exactly.
Yeah, let me say that. And when is surgery indicated for esophageal cancer?
Okay, it depends with the spread. So if you have I mentioned something called carcinoma in situ. If the tumorous or the cancerous cells are still just at that specific part of the esophagus, there's also many other factors to consider at what point. If it's too proximal, if it's very near the, let's say the vocal cords and the other pharyngeal muscles, there is no need for surgery because you have to have a wide margin. Like if the tumor, esophagus itself is around, measuring it from the pharyngeals, from where it exactly starts to the stomach, is around 25 centimeters. To remove it, you need to make sure there's a margin proximally and then a margin distally to make sure you're not leaving any cancerous cells. So if you have it very proximal, you might not have that wide margin. So even if you do the surgery, it will not be helpful because most likely you still leave some cancerous cells inside. But if it's around the midpoint, let's say at around 12 centimeters, working with the 25 centimeters, you'll be able to resect it. That's the first factor. The second one, I said that the first one is the spread. If you have nodes already infiltrated, if you have the lungs already with the tumor cells, if you have the liver already with the tumor cells, surgery will not be helpful.
Okay. And just to say this, when a person comes across this word cancer, they start getting worried. What is the survival rate of this esophageal cancer?
Yeah, the problem is most of the patients that we meet, they are actually in fourth stage. And that's why I started mentioning health-seeking behavior. So if you are in fourth stage, your survival rate, it's actually very reduced. But if, let's say, we are catching it in first stage, 5-year survival rate is put at around 10%.
Okay.
And that 10%, you can see it's still not that much.
Yeah.
So catch it early, start your chemo and radiotherapy early enough. It actually can increase that to even up to 10, 20 years, depending on how old you are even. So if you are 80 years old and that's when you're catching it the first time, it's likely to reduce the quality of life.
Okay. All right, because actually the prevalence is expected to increase by approximately 140% by 2025. That is, so each and every person has to take that responsibility, go to the health facility of which we're talking about, St. Mary's Mission Hospital, in case you have these signs. Okay, let's talk about are there some of the ways that can be done to reduce the risk factors of developing this disease?
Yes, we talked about the risk factors. Yeah, and you can see most of them is modifiable. Yes. So if there is anything modifiable, just modify it. If you are smoking, just stop it. If you are drinking, just stop it. There are things that we cannot modify, like our genetics. It's flesh. It's a flesh and blood. We cannot change it. But things like lifestyle, exercise once in a while. Not once in a while. You can actually make it a routine, and it works. However busy you are, I'm so sure that 3 hours that you spend on Netflix, you can actually get just 1 hour for your workout, and it will just work fine.
All right. And thank you so much for that, Dr. Saul. And I think I forgot to mention, to ask you actually about something. Can this esophageal cancer be hereditary?
I wouldn't say hereditary, but so long as, let's say, someone in your family had it before, unless, there is acquired and something acquired and something that is hereditary. So if you have the cancer, we will not say that for sure your children are likely to have it. But if your case was genetically predisposition and your offspring also have the same genes as you, they have inherited your genes. So if they have other triggers that can actually predispose to cancer, then they are at a higher risk. But it can actually be the fact that you have the cancer not genetically predisposed. So you cannot say that your offsprings or your progeny have the same risk.
Okay, all right. Thank you so much, Daktari. And to Venancio, I'm hearing that you have some problems with the sound. Sorry about that. Hoping it will get better. And as we wind up, what's your parting shot on this general topic of esophageal cancer, and what do you want to tell our viewer out there?
Sure. So generally, I'll not just speak of esophageal cancer, but health-wise itself. Cancers involved and even for infective conditions. Most of us want to treat ourselves at home. Most of us want to persevere or just leave it out, whatever the kind of ailment that we have. I think seeking health care, like our health care seeking behavior, needs to be improved. So if you have even them, sometimes I know we have my headaches that we know by midday it will be over. It's just morning headaches. But do you ever just stop and wonder, could it be something else? Yeah, whatever you're having. Today you are trying to eat, let's say eat your usual choma, nyama choma. You have problems swallowing it. Actually you can feel you have a difficulty swallowing it. But when you're eating, let's say your minced meat, you can actually feel that you're swallowing it well. Then after a few times you find that you're having a problem swallowing your very much beloved ugali. But when you're taking porridge, it actually passes vizuri. Because that's how actually cancer develops. First you have problems swallowing solid foods. Then you start having problems swallowing semi-solid foods. And then it gets to a point where you now struggle to swallow milk and even water. Those are liquid foods. So why don't you just seek healthcare advice immediately you find you have a problem swallowing your nyama choma? You don't have to wait till the only thing you can tolerate is milk before you go to a doctor. Yes.
All right. Thank you so much, Dr. Saul Naibei, who is the medical officer at St. Mary's Mission Hospital. Thank you so much for making time even to come to share to our viewer about this topic of esophageal cancer. Thank you so much, and may God bless you and all the staff at St. Mary's Mission Hospital, of which to you, our viewer, we still, I'm sure you have another branch in Elementaita.
Yeah, we have a branch. The closest branch is at St. Mary's here, just in Langata, along the Unit Road. And then there's one, I'm sure most people, whenever you're traveling to Western, come on, Otoka Western, when we love traveling, you have seen it along the road in Elementaita. Yeah, and then we have even a clinic in town. And there's a clinic in town.
Plaza.
Yes, yeah. So whenever you are, just pass by any of our clinics and you'll be checked.
You can be able to access all these services, and they're very affordable to everyone out there. Thank you so much to the ones that have been tuning in. We have Venancio Nganga, who is talking about my voice. Sorry about that. I have some common cold, hoping next week I'll be better. And to the team that has been behind the camera, we have Cherubor, we have Frederico Cheng, Christopher Obiambo. Lastly but not least, we have a transmission manager, that is Michael Kibandi. May God bless you all. Wishing you a lovely day, and enjoy your day. God bless you. See you next time.
Capuchin TV, your Catholic broadcasting ministry.
St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department. and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa hivi mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.